have open wounds here and here.
39-year-old Michael Duffy has been living with pain in his legs for several years.
Discoloration of the legs, open wounds that don't heal.
Michael is getting prepped for a procedure to look at his lower extremities, performed by interventional radiologist Dr. Kirk Minkus.
So this patient saw me because he was complaining of bilateral lower extremity swelling. Usually you think of possibility of varicose veins or things that are going on in his legs, but I also take a look in the pelvis and the abdomen to see if there's anything there. And I was able to see with intravascular ultrasound and fluoroscopic imaging that he had compression of the left common iliac vein coming out of his leg from an overlying artery. It's okay.
The condition is called May Thurner Syndrome.
May Thurner is compression of a pelvic vein from an overlying pelvic artery. They overlap, and the artery is pumping, and it's strong, and it pushes down on this compliant soft vein to a point where it smashes it, and it doesn't let the blood come out of the left leg properly.
Dr. Minkus says the condition affects millions, but is severely underdiagnosed.
And people focus on the veins in their legs, like varicose veins, which a lot of people know about those terms. But if nobody looks above that area, up in the pelvis, they'll miss May Thurner, and that happens all the time.
I didn't know about this for years. I'm a veteran, and the VA never told me about this. And I've seen vascular doctors, I've seen cardiovascular doctors, I've seen vein doctors.
So we go in and we did what is standard routine, and we take a wire, we put it underneath the area of the compressing artery, right through the vein. We put a stent in that area, and we scaffold and stent up the vein to push the artery out of the way.
I thank God that I came to find myself with Dr. Minkus. He's the one that's gonna cure me from what's going on with me.
These type of 25-minute procedures can solve years and years of aggravation that was not initially found. And so we can find it, we can stent it quickly, and we can cure the patient.